Well, good evening, everyone. I'm so glad to see everyone. Happy New Year. Thank you for taking the time out to attend the Georgia Lupus Collaborative Virtual Winter Workshop. That's a lot of words. I am Georgia State Rep Kim Schofield, and I'm so happy to be here with my colleagues and to see each and every one of you. Tonight, we're going to share some great information. You're going to hear some wonderful things being done in the lupus space. And we invite you to not only engage in the share, but to put in the chat any questions, any comments as we move forward to advance lupus across the state. So again, we thank you. We welcome you for being here. And we're gonna, I'll shoot it over to Sam for any opening remarks, and then to Terry, and we'll take it away.
Thank you, Kim, and thank you everyone for joining on this evening. This is the agenda that was sent out. And by the way, the whole term collaborative is just that. The point of the Georgia Council for Lupus Education and Awareness is really to leverage the wonderful community that we have in our state in a variety of different fields and different talents so that we can better serve our constituents in the state who have lupus and who care for those who have lupus. So if you have items that you want to share in the future, please look out for opportunities to do so, and we are open to that. Let Terry know, go to our website. You can Google Georgia Council for Lupus Education and Awareness. Let us know. Our council meetings, our monthly council meetings have a public forum opening time. So that's another avenue in which you can inform the council what you're doing and how best we can serve you to get you plugged into the community. So I throughout this idea of just giving some updates along the lines of research, and I'll go ahead and do so now. Number one, I just wanted to give people a reminder that there's actually a lot going on in the field of lupus. It may not feel like it at times, especially when you're dealing with the day-to-day of having lupus or caring for someone and you don't see the change directly in your life. But know that if you go to a public repository called PubMed, P-U-B-M-E-D, it's the National Library of Medicine. It's the main repository for primary scientific journals, the ones that have been peer reviewed at the highest standards. And if you search for articles related to lupus, just in January of 2023 to date, there are 197 articles published in a variety of different areas, as you can see here. So how in the world, in the few minutes that I have, do I present on research that's going on in lupus? So I thought I'd figure to start with what's going on locally or regionally, what has been published from those of us in Georgia, and then briefly talk about what I think, and this is purely subjective, but what I think is one of the major kind of stories that people are talking about, and just to bring that to the community's attention. Many of you know Christina Drenkert. She really has been a partner in our lupus research group. She recently semi-retired. She's still very active with us, but she has really advanced a lot of the research in cutaneous lupus because we have that significant portion in our goal cohort. There are very few large, especially groups that have underserved communities in them, and we're fortunate to be able to do that. And so she's really taken upon herself to lead this article. It's a review article. In other words, it's not original research, but she's looking at the field and looking at other peer-reviewed research in the field and summarizing that. And she talks about, she reviews articles as it relates to patient perspectives, and know that many of you who suffer with skin involvement, that your perspectives are are slowly being heard more and more. There are scientific articles that talk about the impact on the mental health of individuals that live with cutaneous involvement, including social anxiety and how you respond to having these issues, the coping strategies, both good and bad, that are involved, the physical impact, obviously, but also emotional distress, hopes and fears, how it impacts relationships, and stigma. What does having skin lesions, how does that stigmatize individuals in the community? Christina also reviews many articles that have been talking about the health-related quality of life in individuals with skin disease, depression and psychiatric conditions, social determinants of health and cutaneous lupus, how the healthcare system has deals a lot with individuals with skin lupus. There's interesting associations between skin lupus and cardiovascular disease, the relationship between skin-limited lupus and systemic lupus, and also kind of delves into thinking from her perspective about the unmet needs and opportunities that qualitative studies, meaning studies not just looking at numbers and statistics per se, but interviews and pulling out themes and really the stories as it comes out and sheds light on the information in that area. And those types of studies are needed more and more. Better education in general, but including those who live with it. There's also a lack of culturally sensitive interaction style and educational materials. We need better advancement in cosmetic care and more study about how the social determinants impact cutaneous lupus. And her expertise really came out of a study called SOUL, and SOUL stands for Skin Outcomes Uncovered in Lupus. And it's one of many sub-studies, if you will, that comes out of our parent study GOAL. And so there's many ways that we've taken advantage of that foundation, that amazing foundation of GOAL, and all the people and the individual who've taken their time to tell us a part of their story. And one of the articles that was recently published is here, again, led by Christina and others in our group, including Charmaine. We have our statistician, Gaubin. Laura Aspey is a dermatologist that works very closely with our group. Tanae Lewis is a social scientist, very interested in lupus at Emory. And in this study, the conclusion here is that the findings emphasize the psychosocial challenges faced by individuals living with primary skin lupus, and that the analysis suggests that stigma and being isolated socially are the main drivers that seem to lead to a lot of depression and depressive symptoms, and that perhaps early identification of social isolation would be and stigma could be a way to better identify individuals who need this kind of help and to minimize depression and its significant effects. The way that how this research can translate into what we do here in Georgia is that it really underscores the importance of clinical attention to the diagnosis and management of depression among patients with skin lupus. And it suggests that, as I said, that there may be intervention points that prevent depression from occurring, and that early identification of individuals who are socially isolated, that suffer from stigma, combined with effective interventions to address these issues in the community, could help prevent these people from becoming even further isolated and having deeper depression, which leads to other poor health outcomes. And then on a public health level, we could perhaps think about campaigns that raise awareness about these issues, that including skin lupus itself, that these potentially disfiguring conditions may help to reduce the social stigma and reduce the psychological impact on individuals that live with this disease if we're able to bring more awareness about this and how it is in the community. This is one article regarding cardiovascular disease and going into our goal cohort and Georgia Lupus Registry. We've known for a while that heart disease is very significant in people with lupus. We've known for a while as well that certainly heart disease, as time goes on, when lupus has more of effect on the body, and also the treatments from lupus build up, especially prednisone, steroids, and other things, those contribute to heart disease. So it's no surprise that we expect and we do see, unfortunately, a lot of heart disease, especially as the years go on after living with lupus. What we didn't really recognize earlier until this study was that this line here represents when individuals were diagnosed. And then you can see going to the right, the years after being diagnosed with lupus. And the different colors that you see here represent the numbers or the amount of certain cardiovascular events. The lighter color here are strokes. The darker colors, for the most part, that you see up at the top is ischemic heart disease or heart attacks. And the really dark color towards the end here is peripheral vascular disease or poor blood flow outside of the heart in the periphery, like the legs or the arms. And as I said, we know in all three categories, ischemic heart disease, stroke, and peripheral vascular disease, that there's a significant burden as the years go on after diagnosis. But what we didn't recognize up until now is that there's a significant burden early on, and especially with strokes for some reason. And even a year or two before diagnosis, there's numbers of ischemic heart disease and some strokes. And there's a racial disparity that I'm not showing here, that it really disproportionately afflicts people who are Black or African American. And it really kind of talks about, it underscores the ongoing scourge of social factors, which really is what race tells us, and how it continues to have a disproportionate impact on a key part of our community. We know that we had the Georgia Lupus Registry funded by the CDC in Atlanta. It identified individuals in the heart of Atlanta with lupus. It was a springboard to GOAL and all these other projects. We have new CDC funding to look now into rural Georgia, as outlined by this red line here. So all this is to say that over the next several years, 5 years, we're going to be scavenging the entire area of South Georgia in all the ways that we can, and we used in Atlanta to identify individuals with lupus, and ultimately hope to identify the issues that we are in Atlanta, down in rural Georgia. And I'm sure there's going to be a lot of commonalities, but there will probably be some individual issues or local issues specific to rural Georgia. And so as a community, I ask that you keep this project in mind. We certainly over the years are going to need partnerships to reach out to healthcare systems and providers to be able to go into their systems to help identify these individuals. So if you work along the lines of healthcare systems, access, data management, especially in those individuals that are seeking healthcare that might have lupus in South Georgia, I would love to be able to interact with you through the collaborative and to advance this project. One other thing locally that I'll mention before talking about the one international issue that I think may be important is this ECHO project. Project ECHO. ECHO stands for Extension for Community Healthcare Outcomes, and it's a model by which one can move knowledge not necessarily the patients. And it's designed to help get better interaction and of knowledge amongst healthcare professionals where the expertise doesn't exist locally. So in rural Georgia, and part of why we're very interested in looking down there is that there are very few rheumatologists relative to some of the bigger areas in the state. And that's going to have an issue, obviously, without the expert care. So what's one way we can make an impact on that? We could have at a major academic center like where I work at, where we do have a lot of expertise in areas in rheumatology, including lupus. Can we interact with local providers through remote technology, virtual technology? And it's this hub and spoke knowledge sharing where community providers learn from specialists. So we have regular meetings virtually where we have topics on lupus, but we also envision in between having other topics of interest in rheumatology. But every other month, we're going to meet every month, but every other month it'll be a lupus related topic. So overall, about 50% of the time we will spend on lupus. And when we do meet, yes, the knowledge goes from the specialists at academic centers to rural providers, but the knowledge also goes back from the rural providers to the specialists so that we learn about the issues that are going on locally. And we all learn from each other. The providers learn from each other, so it's a nice interaction. So I bring this up that if you have any connection with providers who need better rheumatology education, lupus education, this is rolling out through DPH's Project ECHO in lupus and rheumatologic conditions. So please be on the lookout for that, and it should be on their website soon. Now, what I'll finish with here is this thing that made a splash in the fall of 2022. And it's CAR T-cell therapy. There was a group in Germany that used this technique where they treated 5 patients with very severe, by any definition, systemic lupus, and achieved a remission or no disease activity after receiving this therapy several months, many months out. This is an approach that has been used in certain cancers like lymphoma, multiple myeloma, and ALL or a certain type of leukemia. These individuals were 4 women, 1 man with lupus. They were about an average of 22, so pretty young, had about 4 years of living with lupus, and very severe. They were on multiple medications, each one of them, and they did not respond. And many of them did have kidney involvement as well. What it entails is that the patients they have blood taken out of them, and T cells, which is a type of immune cell, is then expanded in a certain medium so that they are engineered to be a type of T cell that is highly attracted to B cells and is able to calm them down. And we know, or many of us know, that B cells are important in lupus because they're the cells that produce antibodies, which is good. But when you produce autoantibodies or antibodies against yourself, that seems to be one of the major triggers in lupus. These re-engineered T cells are then grown up and then put back into the individual. And once that happens, these T cells will propagate or reproduce, and they'll self-sustain, and it'll be a permanent state. There'll be significant numbers of these re-engineered T cells that then calm that are very attracted to the B cell and turns them off. What's appealing about this approach is that when they were tested in these individuals, a small number of individuals, on the top you can see these levels of autoantibodies that we see in many people with lupus. go down very significantly over time. And then on the bottom here, there are different types of B cells. And you can see for the most part, this is, I think, about 100 days out, what we call the reconstitution period. But 100 days out, a lot of these B cells do go down, but these naive B cells come back. So a certain type of B cells come back, but these B cells are baby B cells. They are hopefully the ones not doing the bad, trained to do the bad things. And you're able to use the B cells in the way that we're supposed to. So, these clinical trials very early are something that are highly, they cause a lot of excitement. And I think this is something to be excited about, but there are a lot of questions that I can't get into right now because of time. It's still obviously a very small number. We need more time to see what happens to individuals over the years, but it is one proof, I guess, of all the amazing things that are happening in the therapeutic field, along with a lot of other clinical trials that are equally promising in different ways. So keep an eye out for that. Thank you for your time, and I'm going to pass off to, I believe, Terry. You're on mute, Terry.
Can you see my screen? You can?
Yes.
Okay.
Yes. Okay.
Okay. Sam, thank you for your wonderful presentation about research. This is important information for us. And I would just like to, at this time, introduce Chris Reed, who's going to be our speaker. And he's going to talk about an interesting project that we've been working on. And this is a DS HELP, which is Deep South Health Equity Lupus Project. And it's out of the University of Alabama in collaboration with 4 states. And he'll give you more information on that. But please let me introduce Chris. Chris is, he was diagnosed with lupus in 2001, and he has been just an integral part of everything we do here at the chapter. He's used all of his tools and all of his education as a lawyer, as an advocate, as a person living with lupus, as a man living with lupus, to really advance every initiative that we have had. And he works as a project manager for us, but the work that he's doing with the Deep South Health Project is really incredible. And I would like to pass this over to Chris Reed at this time.
Thank you, Terry. And thank you, Sam, for that great presentation. I'm really excited to hear about the ECHO project. I know we've been working on trying to join that project for a while, so I'm glad to hear about the ECHO project tremendously. As Terry mentioned, I'm Chris Reed. I have lived with lupus for 32 years, and I'm excited to be a part of this Deep South Health Equity Lupus Project. As Terry mentioned, it's out of the University of Alabama, specifically at the University of Alabama in Birmingham. Our partners include the Mid-South Lupus, what was formerly the Mid-South Lupus Foundation, or Lupus Foundation of America, which is now the Southeast chapter of the Lupus Foundation of America, and Amy Yalton, who's the president and CEO. Our wonderful Terry Iman and the Lupus Foundation of America Georgia chapter. The American College of Rheumatology as a partner, Meharry National Alumni Association, Tuskegee University, National Center for Bioethics, Dr. David Hodge, 3 academic researchers, Dr. Rosalind Ramsey Goldman, Alicia Sneed, and Candace Feldman, also participated in this project. This project was funded by the National Lupus Outreach and Clinical Trial Education Program through the Department of Health and Human Services, Public Health Service, and the Office of Minority Health. Specifically, this project was funded based on its ability to fit these specific criteria. One, the program itself had to be a multifaceted approach to increase minority participation in clinical trials. The interventions had to be effective in addressing provider and patient side barriers to minority participation in clinical trials. And they must be developed and implemented within communities. These interventions also must support development of relationships with minority individuals with lupus and local healthcare providers, and include partnerships between communities, as well as provide a source for disseminating existing resources to communities. So today I'm going to tell you a little bit about one component of this project, because this is a 2-year grant with the Office of Minority Health. And so we just completed year 1. The overall goal of the Deep South Health project is to increase participation of Black lupus patients, Black primary physicians, which includes OBGYNs, internists, family practitioners as well, and Black health disparity researchers and clinicians who work in the clinical trial arena. Our focus is to address underlying systemic racism in our 4 Deep South states. We've divided our participants into 3 different groups. We have 100 persons living with lupus from our 4 states in group 1. And they have been, over the last several months, have been working on what we call lupus conversations. And I'll go into lupus conversations a little bit in a moment. In addition to that, group 2, which is made up of 100 primary care physicians, they'll be using the ACR, American Rheumatology Mimic program, which I'll go into. And then group 3 will be focused, their focus will be specifically on clinical and health disparities research. And so they won't be using a specific intervention, but we're working to find ways to increase participation in clinical trials amongst African Americans. So, as I said, the participants in group 1 were recruited from Alabama, Tennessee, Kentucky, and Georgia. They were all part of the Lupus Foundation of America. They participated in what's called Lupus Conversations, which is a project out of an intervention out of the University or Northwestern University and Harvard University and Brigham Health Hospital in Boston. And doctors Rosalind Ramsey Goldman at Northwestern, Dr. Candace Feldman at Brigham and Women's Health Center, as well as Dr. Sneed, who's at Michigan, I believe at Wayne State, if I remember correctly, all put this Lupus Conversations modules together. And they're essentially six different modules that discuss clinical trials, from everything from discussing what a clinical trial is and the clinical trial process, to better ways that both patient and doctor can communicate together about clinical trials. There are all 6 PowerPoint presentations that are given to each individual, each of our 100 patient participants, and they all learn specifically about clinical trials. And then each participant is assessed to measure their level of knowledge about clinical trials, both on part of a pre-survey as well as a post-survey of all study participants. Once the participants, our patient participants, completed the modules, the Lupus Conversation modules, then they were involved in a peer discussion. We led 5 different peer discussion groups, with all of our subjects. Each of those sessions were led by a peer ally who was specifically designated because of their prior involvement in clinical trials. They were specifically asked, all participants were specifically asked to answer some open-ended questions about everything from the knowledge about their knowledge about clinical trials to what kind of conversations that each individual had about clinical trials within their working group, within their doctor-patient relationship, and with their family and friends. Patients were also asked to discuss existing barriers to clinical trials. And then patients were also asked about communication and exclusion from clinical trials. With respect to knowledge about clinical trials, it was amazing that many of the participants did not know anything about clinical trials. And in fact, in all 5 of our groups, our participants were a little bit confused on what defined clinical trials in the first place. And so we had to certainly clarify that for each participant. Most of the participants did indicate when asked about conversations about clinical trials, they indicated that they had not had very much discussion with their doctors about clinical trials at all. In fact, that many of their doctors did not even approach them specifically about participating in the clinical trials, or the conversation never arose. With respect to barriers, many barriers included transportation barriers so clinical trials are taking place in metro areas, larger cities, and therefore those individuals who live in smaller towns and rural areas don't have the transportation to get to the larger cities to participate in clinical trials. So that was certainly considered a barrier. And then communication about clinical trials. Many participants indicated that they learned about clinical trials through social media. So they were either saw a social media post about clinical trials and decided to contact a clinical trial recruiter, or those individuals indicated that they were able to find out about clinical trials just through word of mouth. Very few indicated that they found out about a clinical trial through their care providers, through their healthcare providers. And then exclusion, majority of our participants indicated that they did not feel necessarily that having been excluded from a clinical trial meant that they would not participate in a clinical trial. And then one of the last questions that we asked in each group was, after taking into consideration the Lupus Conversations module, as well as the discussions that we had during each of our 5 sessions, all of the participants, with the exception of just a small handful of people, indicated that they would be willing to participate in clinical trials. We followed the discussion sessions with the 2023 Lupus Culminating Conference, where we were able to, one, evaluate the researchers. So our 100 participants participated in conversations directly with the researchers. So with Dr. Ramsey Goldman, Dr. Schneid, and Dr. Feldman about the Lupus Conversations and modules. Part of that conversation included discussing the program itself, so the Lupus Conversations program, and whether or not it was deemed to be helpful to each individual, whether or not they felt like the evaluation process was fair. In addition to that, the Lupus Conversations modules were evaluated by our participants as to whether or not it was easy to understand, and whether or not language needed to be changed, or whether or not there were a need to expand on certain issues, certain elements of the Lupus Conversations module. So what are our next steps with respect to this program? We are going to next evaluate all the group answers, both to their answers to Lupus conversations, as well as their answers during our discussion groups. They'll be all evaluated by our evaluator at University of Alabama. We're still working on recruiting groups 2 and 3. So if you know African Americans who are primary care physicians, OBGYNs, general practitioners, and an internist, please have them contact us to participate. And if you know of any researchers who are African American, we are looking for researchers, individuals who've worked in clinical trials. We'd love for them to participate as well. And that would be in group 3. Our group two will be using as their source of education materials to increase minority participation in clinical trials, or MIMIC, which was designed by the American College of Rheumatology. And then at the end of this year, we'll have another culminating conference where we're specifically discussing the subject matter with our groups 2 and 3. And if you're interested in participating in this project, please contact our principal investigator, Dr. Pamela Payne Foster, at the information above. And I'm open to answer any questions anyone may have. I'm open to any questions. What I'll do is put the Lupus Conversations link into the chat, so you can have that.
Okay, thank you, Chris. Thank you for your presentation. And it really was a wonderful day. And it was great to hear from all the participants how they felt about the program and their feedback. And I think it was that was probably what I took away. The keynote speakers were phenomenal, and Kim Schofield was one of them. Just great. You motivated us, and you gave us a great start to the day. And then we talked about the history of clinical trials and what were the differences and the pros and the cons. You guys just hit on a lot of really key points that I had never considered before. So I'm really grateful for the work that you guys did. Can you see my screen now?
Yes.
Okay. Okay, so my name is Terry Emond, and I'm the president and CEO at the Lupus Foundation of America, Georgia chapter here. And I want to thank you all for being a part of this. And I want to thank Dr. Sam Lim and Chris Reed for their wonderful presentations tonight. And this really is, you know, Sam always says to frame things from the point of view of collaboration. So everything I'm going to talk about, and I'll go quickly, I want you to think of how anybody who's on this call tonight can be a part of what we're doing, because that's what we, you know, Dr. Mashua is on the call right now, and she presented something years ago, the first time I met her. If we want to run fast, run alone. If we want to run far, run together. And that's what we want to do. We want to run together. And this is not a sprint, it's a marathon. And I appreciate all this collaboration, everybody joining us. So let's just talk about some of our goals and priorities for 2023. So the strategic priorities for the Lupus Foundation of America are to reduce time to diagnosis, ensure lupus patients have safe and effective treatments, and expand direct services, increase access to treatment and care. So what steps will we take to reduce the time to diagnosis? One of them is to expand our school health outreach program. Chris Reed and Kim Schofield brought this program into inception years ago, and we've continued to grow it. And we're doing it again this year through the ACR. We're very proud of this program. We have educated over 400 school nurses. and getting that information, that vital information, into schools so that teachers, nurses, doctors, and parents can work in partnership to improve the health outcomes of their students, lupus patients. Expand our Be Fierce, Take Control campaign on HBCU campuses. We visited 3 campuses last year, and we'd like to visit at least 5 this year. And we've got some great sororities who have engaged with us to do it, and we're excited about these possibilities. Homecoming seems to be a great time to go to the campus and hand out information. We have a captive audience there, and the students have been really receptive. But what we want to do is we want to identify young women and men who might have the symptoms of lupus, but not know that it's lupus. They're just feeling a little off. And we really want to make sure that they are putting the pieces together, going to see a doctor. If it's not lupus, fantastic. If it is, then they can get a protocol, because that early diagnosis is going to lead to a better prognosis. Okay. Establish additional community partners. This is my call to action to all of you. You guys are our community partners. You know, we need to work with universities, with the ACR, with Emory University, with foundations, with institutions, companies, to help us spread the word about what lupus is. So we really want to establish these additional community partners and make sure that we're expanding the base of knowledge and how we can get it out there into Georgia, across Georgia. Leverage our media partners to increase awareness. We've got great support through our media, but we tend to use it only for certain campaigns. And what we'd like to do is to expand that to a campaign across the year, so that you're hearing people shout about lupus all the time. Second priority, ensure lupus patients have safe and effective treatments. We have to advocate, we have to increase lupus advocate participation. We did this by going down to the Capitol. We've got Chris Reed and Alita McLean are on the line, and they are our co-chairs to our advocacy committee. We're going to the Capitol on February 23rd. Kim Schofield is sponsoring us, and we are going to have an amazing day. Kim gets all of her legislators to wear purple capes, and we hand out suckers because we know that lupus sucks. So we are going to really just keep broadcasting this message and fight for some of the initiatives that we have become near and dear to our heart. And some of them were identified through the needs assessment that we did last year through the generous grant from the GCLEA. And one of those is paid time off for all. One of the things we learned in our needs assessment was one of the reasons people don't go to the doctor's appointment is because they can't take time off from work. So that's one of the things that we are going to advocate for. Promote LFA-supported clinical trials and continue education on clinical trial participation. So the the DS Help program that we've been involved in is really supporting those clinical trials education. And we're working with people like Dr. Mashua to really put together some programs to educate people in Georgia about clinical trials. It's important when we look at the percentages of minorities that are involved in clinical trials and those who are compared to their percentage of the general population. Expand direct services and increase access to treatment and care. Okay. We want to expand our emergency financial assistance program. This has been just a real lifeline to a lot of people, and we're looking for expanded funding for that. As a matter of fact, our last gala that we had before the pandemic, we earmarked all of the money raised at our fund a mission for the emergency financial assistance program. And we'd love to develop a co-pay program and do that. We're just working on that, and that is in the works right now. Hire additional program staff. If we're going to grow these programs and make them more robust, we need additional staff. This is a picture of our staff at our recent Christmas party here. They're amazing. They do amazing work here. We just need to grow our efforts and grow who we have working for us. Continue our lupus ambassador training. So right here is We've got Alita McLean, we've got Adrian Ayande, and Chris Reed, who are 3 of our ambassadors. Now, this is a group that has been trained to go out and speak on behalf of the foundation, and they can go out anywhere. Adrian's going to she went last Saturday to a program for CVS Help, and she's going to another program down at the Capitol, down at a church near the Capitol with Kim Schofield on Saturday. We're proud of this group. They are energized. I think several are on the line tonight, and we're really grateful for all that you're doing. Then our last one is develop a health communications plan. We feel that this is really vital to what we want to do in the state of Georgia. And when we talk about a health communications plan, it's not just a plan for emails and social media. This is a plan for getting information out into rural clinics with community health workers, with getting into the clinics in Albany and in Valdosta and the places where there aren't rheumatologists to get them information that they need. But what we need is a strategic plan to do this. And we intend to hire a consultant to help us put this together because we want somebody who really knows what they're doing. And then expand our community health workers initiative. This is just a great program where our community health workers are going and we're educating and certifying them so they can help identify people living with lupus and get them the resources that they need and point them back to the chapter. Expand our patient navigator program. This is Alondra Zapata. She is our new patient navigator. She's working at the Grady clinic, and she's working at the Midtown Nephrology Clinic. And this is through a generous grant through Aurinia Pharmaceuticals. But she has expanded what she is doing into working with our general population and constituents who call into the office. She's offering them those services. We've been able to give her additional hours to do that. And it's just amazing. And I know Sam brought up at one time about the isolation with lupus. I know you're talking about cutaneous lupus. But what we're amazed is that almost every person that Alondra has contacted wants to be part of a support group. I didn't expect to have that much buy-in. Almost every single person she has contacted wants to be a part of our support group. We've got what happened with the pandemic. We have a virtual support group that has just really, really grown in scope and size. And they've joined into this group. And it's just an opportunity for them to meet when they can't necessarily get to a physical meeting. They can meet online, but it does help with the isolation because they share their stories and they help each other. I've had the privilege of sitting in on a few of those meetings, and I walk away just absolutely blown away by the kind of support that they give to each other. Adrian Allende, who is on the call, works in our office, and she often talks to me about how when I talk to somebody with lupus, I can give them empathy and the understanding and the knowledge and resources. When Adrian, who has lupus, talks to another person with lupus, they're talking a different language. They're talking their own language, and that's so important. And we're so proud of our support groups. It's always been, programming is my background and it's my passion, and it's always been something that's been very important to me. So we are so glad to be able to expand this patient navigation program. Alondra has identified a lot of resources for us, and we hope to continue to grow it. Now, I would be remiss to leave this conversation if I don't talk about our Walk to End Lupus Now. Okay, we're in 4 cities. We're back live this year. This is just an opportunity. It's an opportunity to raise funds. Absolutely. I would be a CEO. I would be, like I say, remiss not to mention it, but it is an awareness opportunity. Everybody on this call who's been to one of our walks before, this is an opportunity to get out and just shout lupus matters. We turn Atlanta, Augusta, Macon, and Columbus purple on 4 different occasions across the year. And we're so proud of all of the support that we get for this, for the walk, and how people have come back after COVID and come out and trusted us and enjoyed it. And we're back at Piedmont Park in Atlanta, which is huge. So we're, I'll close on that, and I'll let Sam close it out here for us.
Thank you, Terry. Thank you so much, Chris. That's just the tip of the iceberg. That alone, I mean, just the two speakers there, just there's so much to unpack. But we know that there are so many others represented here on this virtual meeting and those who couldn't make it tonight that are doing so much each and every day. So I do want to thank all who spoke today, but to continue to encourage the rest of you to keep fighting, fighting individually, fighting to take care of the ones that you love. And we'll keep fighting to help support you so that you can be the best that you can be and to have the life that you deserve. We are working towards continuing these workshops or these meetings in the future. You're going to hear of another one in the spring or perhaps early summer-ish. The details will come. Please keep an eye out for it. It will be virtual, but it is going to set the stage for a summer in-person meeting that's going to really kick things off for us. I just want to whet your appetite. There's a lot more to come, and the success of all of this will depend on each and every one of you to join us in this fight together. So thank you so much for your attention, and I am going to let Representative Schofield say the final words before we convene. Oh, you're on mute.
You're on mute, Kim.
Yes, I was trying to get off mute. Listen, I'm so encouraged. If I wasn't exhausted from fatigue, I would be running around in circles. I don't know about you, but the work that Chris and Terry and Dr. Lim is just so precious, y'all. So I just wanted to thank you for being here tonight. Don't get tired. We're just getting started. So I wanted to, again, thank you for being a part of tonight. Tell somebody about what they missed, what you heard, and what's being done in the world of lupus. Listen, lupus may suck, but guess what? We still fighting. Have a good night, everybody.
Good night.
Thank you. Good night.